So good morning, everybody. Happy Friday. Good morning, Mayor. As usual, we will have the Mayor's remarks in English, followed by a Q&A in English, and then we'll have the Mayor's remarks in Spanish, followed by the Q&A in Spanish, and then we'll hear the Mayor's remarks in Haitian Creole with our translator, Lionel. In the meantime, as Sean said previously, please remember to mute your devices and shut down your video while the Mayor speaks. That allows us to keep just the Mayor and our sign language interpreter up on the screen while the Mayor is speaking. You can turn them back on during the Q&A. And with that, I turn it over to Mayor Gimenez.
Thank you, Patty. Good morning, everybody. I want to go over what's happening this weekend as we continue moving to a new normal. First, on testing sites, we continue to add more testing sites throughout Miami-Dade County, and we're relaxing the criteria so that more young people can get tested for COVID-19. Starting this weekend, at two of our drive-through sites, anyone 12 years of age or older may get tested and does not have to be exhibiting symptoms. Those under 17 must have parental approval. A new age limit applies to the testing sites at Tamiami Fairgrounds and the South Dade Government Center. The 18-year-old age limit still applies at the drive-through site at Marlins Park and the walk-up test site at Holy Family Catholic Church in North Miami. For all those sites, you do not have to be experiencing symptoms to get tested. But you do have to call to make an appointment for testing the next day. County residents can call 305-499-8767 to schedule an appointment at Holy Family Walk-Up Site or at our drive-through testing sites. Also, Jackson Health System's urgent care centers throughout the county are providing free testing at any of their locations, and you can walk into those sites. I'm very worried that our minority residents are not taking advantage of testing opportunities, even though there are various nearby testing sites available. So please help me get the word out. As we test more people, we expect to get more positive results, but that doesn't mean that people will end up in the hospital. In fact, most of the people testing positive have few symptoms, or many of them, none at all. And we continue to see a tamping down of hospitalizations. Yesterday's hospital report shows 582 coronavirus patients throughout Miami-Dade County. That's the lowest number of patients in the hospital since I first issued the emergency order number 1820 on April 4th, requiring hospitals to report their numbers daily. This week, I also issued emergency order 2220, requiring all nursing homes and residential healthcare facilities to report the number of patients and the staff who have tested positive for the virus. As you know, from the very beginning, we placed a very high priority on testing our seniors because they are the ones most at risk getting complications from COVID-19. Also, we've been calling every single one of our nursing homes in Miami-Dade County for over a month to see if there's anything that we could do for them or if they needed some supplies. So this is just additional information that we're going to get from them. Unfortunately, some of the nursing homes under the state's authority have become hotspots, so we're partnering with the state to help expedite testing if it's needed. Now this Sunday, we celebrate Mother's Day, and we are moving to a new normal. I know some people are wondering how best to celebrate, especially if you have an elderly mom. If you're going to visit your mom or your elderly grandmother, aunt, sister, or cousin, please do everything you can to keep them safe. That means keeping your distance of at least 6 feet apart. Make sure there are no more than 10 people in a group and everyone is practicing social distancing. Wear a face mask covering whenever inside. Better yet, if you have an outdoor space, a patio, try to do it outside in your backyard or at a park where there's more room to practice social distancing. We have a very clear picture of the problems we will face if we fail to do this. 2 weeks after Easter and Passover, we saw a spike in the number of COVID-19 hospitalizations here in the county. This happened despite our warnings to stay safer at home. People are eager to see each other, and they were so eager that they broke the rules of social distancing. So please, do not put your loved ones or our community in danger. Make sure you wear masks and practice social distancing. And if your loved one is at a high risk, celebrate Mother's Day. You can't consider celebrating Mother's Day by sending a care package, calling your mom, doing FaceTime or something, especially if she's elderly and is at high risk category. Do everything you can not to expose her to the complications from this virus. This week, we're celebrating National Nurses Day and the crucial role that they have and have had during this pandemic. Today at 1 p.m., the Blue Angels will be flying over our county as part of the Operation America Strong, showing support for those on the front lines of the COVID-19 pandemic. They will fly over as many hospitals as possible, eventually ending up over Homestead and turning back north and out of the county by 125. I want to ask everyone to enjoy the show from your home or a safe place. Do not congregate in groups. I want to continue to tamp down the virus and start moving forward, but really show them our support. Now that our parks, marinas, and golf courses are open, things have been going well and people are following the social distancing rules. We're meeting the gating criteria issued by the CDC and the White House. I'm very pleased. There is a light at the end of this COVID tunnel. Interior Spaces working groups have wrapped up most of those plans. Tomorrow I'll be meeting with our medical experts who have worked with those groups. I have spoken to the governor and he is in agreement that Miami-Dade should move forward with opening up certain sectors of the economy with a target date, and I stress it again, this is a target date of May 18th. I want to go over all the rules so that they're clear before executive orders are issued to open businesses in a safe way so that people can get back to work. At each step, we've been following the recommendations of our medical experts. They include the Florida Department of Health, doctors from Jackson, UHealth, and the medical schools of FIU and the University of Miami. As we start moving toward a new normal and opening up businesses in the future, I want to make sure that our seniors and anyone at risk conditions are protected. We need to get the economy going again and do it as safely as possible. And again, we have a target date of May 18th, and we'll start opening up, hopefully start opening up certain sectors of our economy, on that date. Now I'll take any questions from the English media before I make my remarks in Spanish.
Thank you, Mayor. The first question comes from Fox Sports Radio, Andy Slater.
Hey, Mayor, how are you?
Doing well, thank you.
As far as your phase one opening on May 18th, is that going to include restaurants, indoor spaces, and also have you had any discussions with the Miami Marlins as far as baseball coming back? Thanks.
No, I have, second question first. No, I haven't had discussions with the Marlins. I'm sure I will sooner rather than later. Which businesses are going to go open up on that target date? Again, I want to say that's a target date, all right? It's still up to discussion. The restaurant working group still has a little bit of work to do. But we hope to get them and many other businesses open up by the 18th.
Thanks.
You're welcome.
Thank you, sir. Our next question will be from the Miami Herald, Doug Hanks.
Hi, Mayor.
Hey, Doug.
What will you be looking for to make sure that this reopening going safely? What metrics will you be looking for in terms of having to pull back on that and issue more closures?
I think the continual decline in the number of COVID-19 patients in the hospitals, the continuing decline in the number of COVID-19 patients on ventilators. We now have well under 100 COVID-19 patients are on ventilators. The continuing decline in the percentage of positives of the tests that we give. Those are certainly big indicators for me as we move forward. And so there's a certain gating criteria. I think we've met those gating criteria. We need to start moving forward. We need to start opening up Miami-Dade County in a safe way. And so again, the way that we're going to do it is not just, okay, we're back to normal, everybody does whatever they want. These businesses are going to go up, are going to be opening with certain restrictions and with certain safeguards to make sure that we stay as safe as possible.
You don't think those hospitalization numbers will go up as more people interact?
It's always possible. Anything's possible, Doug. And so what we want to do is make sure that when we do open the businesses, that the way we open up businesses restricts or assures, lessens the infection rate as much as we can. Always said, can never lessen it or have it down to zero. There's no safeguards or no for safeguards. There's no you can't do something where you have a zero possibility of infection. If we ended up doing that, then we'd all be in our house, and even there's a possibility of an infection. So no, we got to open up, do it in a way that our doctors say that the likelihood is diminished and that it's safe to do, and also in a way that the businesses themselves can actually operate. And so that's why we've had these groups together and talk and had these discussions for quite a bit of time.
Thank you. WLRN's Daniel Rivero. Did you have a question? Danny?
Yeah, here I am. Hi, Mayor. In terms of what the working group is working on, what are the things that are specifically pending that they're working on? Is that how to social distance within, say, retail or restaurant businesses?
I think most of that stuff is worked out there. I think that the final group that there was a lot of back and forth between some of the owners of restaurants and some of our medical advisors. So that I think we finally got the final draft to us and to our consultants, I think either yesterday or even early this morning. So, but there are a lot of working groups that have had their work done for some time, and then now it's all that went to our consultants. We're trying to be as consistent as possible for the majority of us, the clients, the customers of these establishments, so that for us, it's the same whether we go into this business or another business or another business. But what's called the back of the house, how they operate, they may have to do certain things a little differently because of their particular operation or their particular business. That's what's being worked on. That's almost being finalized as we speak. And so again, we want a target date of the 18th. We want to put out some kind of hey, prepare to open on this date, and here's what you have to do in order to open. So you give a little bit of time to those businesses to get whatever it is that they need to get and prepare themselves to open. Maybe they need to space their workspaces. Maybe they need to clear out some tables in a restaurant. So we want to do that over the weekend and get something out early part of next week so that we can hopefully hit that May 18th target date.
Got it. Just to follow up on that, is the county going to be involved in any kind of way in helping, say, restaurants back of the house securing the PPE that they need, or are they going to be kind of doing that on their own?
We're looking at that also, the ability. It's kind of hard to get some of the stuff, and so how can we help those businesses, especially really small businesses, to get those things that they need in order to open up? We'll be looking at that without a doubt in a way that we can assist them. Again, it's tough for us to get them some of that stuff.
Right.
So as much as we can assist them, we want to assist them. We want to get them back in business. We want to open up, but do it in a safe manner. Always doing it in a safe manner.
Thank you.
Thank you very much. Our next question will be from CNN, Melissa Alonso. Melissa?
Thank you, Mayor. You're saying you would like to reopen the county, but is the community ready, especially with, given the video surfacing showing people not social distancing, not wearing masks, the most recent one showing a man in a shouting match with law enforcement over wearing a mask. Is Miami-Dade ready right now?
Yes, we are. And our metrics are way above most. Look, in New York City, their metrics are 30% capacity in their hospital system. The capacity here in Miami-Dade County is well over 80%. And so we're way above most of the large cities in that regard. And so we're ready, and our rules will be such that it will safeguard our community as much as possible. We're a community of about 3 million people. You can always get an image of somebody doing something wrong here. So I don't really look at much of images at all. Thank you.
Thank you.
Thank you, Mayor. And now I will call on Penny Dickerson with the Miami Times. Penny, do you have a question for the mayor today?
I do not have any questions today. I had oral surgery. I'm listening today.
Oh, okay.
I hope you feel better. Yeah.
Thank you, Mayor.
Okay, I have a few English language stations on here that previously had said they didn't have questions, so I'm not sure if any of you have any further questions before we move on to Spanish. NBC 6, 7, 10.
I do have a quick question with NBC 6.
Okay.
Some of the commissioners yesterday had expressed that they were not involved in this process with reopening or not sure. So do you have anything to say about that, or kind of like if they will be involved?
Well, the problem is that we have a sunshine law. And so whenever I can't have a meeting to discuss things that are not in the sunshine. And a lot of these meetings actually it wasn't appropriate to be in the sunshine. People had to say what was on their mind, and our doctors had to say what was on their mind. And so you couldn't have more than one commissioner. There was a commissioner on these meetings, which is the commissioner that they themselves appointed to be the liaison to this entire process. It was as open a process as we can have, albeit not in the sunshine. And so that's the problem with the sunshine law. I really can't have more than one commissioner at a time that I can talk to, because if not, it violates the sunshine. So the sunshine law is really an issue here. We have internal meetings every day. I have a staff meeting every day. They're allowed to look in, but they can't talk because, again, it's a sunshine issue. I may do the same thing from now on. Now, thinking about it, we have other groups that we have to put together that maybe I could say, okay, you can get in, you can watch what's going on, but you can't say anything because, again, it would be a violation of the sunshine. So, yeah, I think, we learned a little bit from that discussion, but it's really the sunshine law that precludes a lot of this.
Thank you.
Thank you, Mayor. And we have David Snelling with the Miami Laker on the line today, and I believe he had a question. David, are you there? Okay, I see him on there, and I see his mic unmuted, but I guess he's not able to speak up. Okay, Andy Slater had a follow-up question if nobody else has a question in English.
Mayor,
Okay.
have you spoken to any of the city mayors about your reopening plan? Because
Yes,
go ahead.
No, go ahead. Finish the question. Go ahead.
No, I'm just saying because we've heard a lot from Miami Beach, from the city of Miami, and things could get confusing because obviously Miami-Dade's a big county with a lot of cities.
No, we every other day we speak to the League of Cities, which represents all the cities in Miami-Dade. And yes, this morning at 8 o'clock, I told them, hey, this is what we're thinking of doing, and they're on board. The problem is we have 34 different cities, and it's not a problem. It's just the fact. We have 34 different cities in Miami-Dade. Some of them want to do their own thing, which they can. And I hope, before this entire episode started with COVID-19, I had a meeting of all 34 in my conference room and said, we really need to speak with one voice because it's going to become confusing if some of you started doing your own thing. Most cities heeded that. Some cities didn't. They have the right not to. But hopefully once we put our plan out for Miami-Dade, and by the way, Miami-Dade is by far the biggest city in Miami-Dade. The unincorporated area has well over 1 million people. And so, the cities can do more, be more strict than Miami-Dade, but they can't be less strict than Miami-Dade. And so when we allow the businesses to open, that means all the cities can allow their businesses to open. But they can decide not to open their businesses. They can put other rules on their businesses that we don't. But we've had a very, very strenuous process, a very open process, and a very, I don't think we could have, I think the process is very, very good with the input from the Department of Health, Jackson, UHealth, University of Miami, and University, and Florida International University's Schools of Medicine. I don't think you can find a better group of experts. And so what a city is going to determine outside of that, they can. Maybe there's some nuance, some peculiarity in a city. And if there is, then they have the right to tweak it or change it or not abide by it at all, but it can't be any less restrictive.
Do you plan on the reopening, including the beaches?
The beaches, no. The beaches are not going to be reopened in the first phase. I don't anticipate that opening on the 18th. It could be mistaken. Maybe something will work out. But at this point, we want to do those things that are easy to do or easier to do and safer to do first. And then we're going to tackle some of those other subjects, such as nightclubs and movie theaters and all that. That's not going to be in the first wave either. And I don't know when they're going to be. We also have to take a look at the summer school issue. It's coming up, and the parks and those summer camps that take care of a lot of kids while their parents are at work. That's a difficult one. That's a difficult hurdle to jump over. But we're going to be putting together a group to see if we can get that done too.
Mayor? You had mentioned in a memo last night about contact tracing as part of the reopening plan. Can you elaborate on that?
Yeah, part of the reopening plan, it calls for a robust, couple of things, a robust testing program inside the county, which we do have one with If they continue to do that program, we're good. If not, we're going to pick it up. And then contact tracing, an ability to trace, positives and have a robust contact tracing program. We're working in different ways to get that done. There's a manual way, and then there may be some technology that could help us in that regard.
Thank you, Mayor. Okay, and I think we can move on to Spanish now.
I have one more question. This is Denny with WLRN. Well, kind of two-part question. You mentioned, Mayor, that I believe you mentioned that you've been in touch with Governor DeSantis. Would this tentative plan for May 18th require any action on the state's part, since we were kind of excluded from the original reopening order? And
yeah, it may. Actually, it may. And so, we have to make sure that we're in complete concert with the governor. The governor has been nothing but supportive of our efforts here, and I have to compliment the governor and his approach. Southeast Florida has been different than the rest of the state. And so, we talk either every day, every other day, and, what are they doing? What are we doing? I think that they can take advantage of some of the work that we've done here. Hopefully he can use it for the rest of the state. But again, the rest of the state's a little different than Southeast Florida. And so, yeah, we'll be talking to the governor, and we'll make sure that we have his blessing before we move forward.
Got it. And the second part of that question was about coordination with other counties. I know, like right now, Palm Beach County is having a meeting talking about opening up beaches. Have you included these other counties in these discussions for this plan?
We have, and I know that speaking to the governor a couple days ago, it appears that Palm Beach County probably go first, because they don't have the same. It's not the same makeup up there. It is a different county. They don't have the same numbers, and they could probably be a little bit more aggressive than we can down here in Dade. And so I would expect them to take action a little bit differently than what we have in Dade. We had for a long time a 3-county approach to things. I've got to speak to Broward. I don't know, the governor's talking to Broward, and hopefully we can open up pretty much the same way, pretty much on the same date. But again, I'm going to have those conversations with Broward tomorrow.